Hi, my name is Michael Ricciuto, and I'm the founder of Physical Therapy Now. We've been treating patients with shoulder pain and conditions for over 18 years. A lot of our conditions come from pre-surgical, post-surgical, impingement syndromes, people just getting hurt and walking into our office. Well, there are some very specific things that patients have asked me about exercise. What's hurting my shoulder? What can I do if I have some type of impingement syndrome? And what should I stay away from? What should I do? So we're going to take a look at 3 things that you should not do if you're suspecting shoulder impingement syndrome. Now, the only way to tell if you have shoulder impingement syndrome is to get a specific diagnosis and prognosis. You can do that from us by dialing our phone number at 412-794-8352. If this is not an option, you can call us to schedule a 30-minute phone consultation. Let's take a look at the things you should not be doing if you are suspecting shoulder impingement syndrome. The first exercise that you should not be doing if you're suspecting shoulder impingement syndrome is an upright row. The upright row is an exercise where your hands are together on a bar, you come up, elbows flare out to the side, and you come back down. This is a key exercise in pinching off the rotator cuff as you come up. And is not a great exercise in regards to if you're having shoulder impingement syndrome. This is one you're going to want to avoid if you're suspecting having shoulder impingement syndrome. Second exercise that you're going to want to avoid if you are suspecting having shoulder impingement syndrome is a basic push-up, unfortunately. This is not to say that you will not get back into doing push-ups, but you should avoid this if you are suspecting shoulder problems or shoulder pain. You're looking like you have a long arm plank coming down into this, tapping the floor or not, or coming close to it. That's the push-up that you don't want to do. There are going to be variations of this to get you back into being able to do the push-up again. Great exercise if you're not having shoulder pain. Not a good idea if you are having shoulder pain. One exercise that you don't want to do if you are suspecting shoulder impingement syndrome is a dumbbell overhead press. I have 2 dumbbells in my hand. It also applies to a military press. I'm going to bring these up, and this is something either this way in the least vulnerable position for the shoulder or the most vulnerable position for the shoulder. You're not going to want to do any of these presses if you're having any type of shoulder discomfort, shoulder pain. This is one of the ones that gets people a lot. Well, there you have it. There are 3 things that you should avoid if you are suspecting impingement syndrome. Now, that's not to say that you should never do these exercises. Prognosis, diagnosis, and treatment plans are all part of a complete package. When you come to physical therapy, we decipher what's going on, and you can integrate some of these exercises back into your program. But if you do truly have shoulder impingement syndrome, then your shoulder is not going to like these things. You're going to become inflamed into most likely the acromioclavicular region of your shoulder, and you won't be able to progress in your exercises. If you need a hand, give us a call at 412-794-8352. If you would like to have a free consultation to discuss your specific condition, because this is a very specific thing for each individual, then click on the link below and you can have a free 30-minute consultation on the phone with us to discuss your condition to see if we can help you with it. Thank you very much for watching this video, and we'll see you soon.